All right, we'll go ahead and get started. So thank you again for joining us today. My name is Christopher Jammer, and today we have with us Dr. Constantine Pappas and his recovery specialist, Chris Norris, and we are from Airrosti Rehab Centers. So before we actually go through the content of the presentation, just some housekeeping things. Of course, whenever you join, you notice that your microphones were muted and most of your cameras was off. We ask that you continue to keep your microphones muted so that we can make sure that Dr. Pappas and Chris get you guys the information as quickly and as efficiently as possible and make sure we don't have any background noise. If you have any questions that you would like for us to address during the presentation or in the Q&A session at the end of the presentation, we definitely ask that you utilize the chat function in Zoom so that we can get those questions answered as quickly and as efficiently, like I said, as possible. If you have a really, really specific question to yourself or to an injury that you might be dealing with, we will, at the end of the presentation, be giving you Dr. Pappas's contact information so you can ask him directly, so that we don't make sure to share any HIPAA violated contact information for things like that. So, like I said before, we are with the Airrosti Rehab Centers. And if you guys aren't familiar with us, we're a group of healthcare providers that specialize in treating what we call soft tissue and musculoskeletal injuries. So that could be anything from your head to your toes, as long as there's not a broken bone, a fracture within the bone, or a full thickness tear, which is going to require surgery. And so outside of treating these specific injuries, we also like to help people be kind of preventative and proactive in their healthcare. So we talk about a lot of conditions in webinars and in seminars that Dr. Papa sees comes into his office, that we can help people be preventative in those ways. So today we're going to talk about a topic that a lot of people might actually be dealing with. But for now, I will turn it over to Dr. Pappas to take you through exactly what he's going to talk about. And there you go.
Hey guys, thanks Jammer. Thanks for the introduction. I appreciate that quite a bit. One of the unsung things that we do as part of our job is prevention of musculoskeletal injuries. Now, Chris Jammer, myself, our recovery specialist, Chris Norris, and Dr. Fanal, that's in the call here as well. We all love seeing patients. We love the relationships. We love working with people. We love helping you out. We like hearing your stories, your trips, your travels, your tribulations. But one of the things that we enjoy most is not seeing you in the office in the first place. I get more pleasure of seeing our patients pre-pandemic at the local establishments, the local watering holes, out on the sports and athletic fields than I do in the office, because something's wrong if they're coming here. And that's why we do this talk. We do this talk so that we can do our best and do our due diligence to keep you out of our offices in the first place. All right. That being said, this presentation is going to focus on four things. The first three we're going to take on the clinical side. That's myself and recovery specialist Chris Norris. And then the last little bit, our wonderful and awesome guy that organized the seminar, Chris Jammer, is going to take that last piece. And that's understanding headaches, how posture impacts headaches, and then give you some tools, hopefully a couple simple tools for prevention and tracking of headaches. And Jennifer will close it down like that reliever in the bottom of the ninth inning with accountable and outcome-based care. All right, first, types of headaches. Everybody thinks when they come to our offices that every headache is a migraine. The good news is that's not the case. The bad news is there's still a misconception. So we're going to try to tease out, give you some simple ideas of what is a migraine headache, what is not a migraine headache, what are some other common forms of headache that people can experience here, because not all headaches are migraines. So across the top, you'll see TMJ. That's the jaw, this joint right here on the side, this jaw joint. We'll talk about sinus headaches, cluster headaches around the eye, tension headaches, migraine headaches, and then neck headaches. And when we talk about TMJ headaches, so we'll go left to right across the screen here. One of the underappreciated reasons why patients can get headaches is the jaw being off. The jaw is like a little knuckle that sits in the groove. And if the mechanics of the jaw, how it opens and how it's positioned in that socket is off, and the opening and closing is off, it can create a lot of bit of problems, including headaches, lockjaw.
You're done?
Doesn't open as well. Sinus headaches, this is related to Austin. Austin's a high allergy town. And Austin is, in particular, you got cedar season, you got oak season, so sinus headaches right around the sinuses, underneath the eyes. Sometimes there'll be puffiness. Sometimes around the eyebrows, there'll be puffiness and swelling here. Sometimes you'll see it out here in the cheekbones as well. And that's kind of that pain distribution on the screen that you're seeing. Cluster headaches, these S-U-C-K suck. These are sharp piercing headaches, typically around the posterior portion of the eyeball. Often these are debilitating. These will shut you down. Hopefully you don't have this. And a lot of times if they do have this, this needs to be referred out to our colleagues in the medical world, because conservative world, we don't really have really great treatments. Tension headaches, who remembers the 80s, right? If you are not a millennial, you probably remember the 80s. Remember those headbands those tennis players used to wear across their head, those 80s tennis stars? This is your headband-based headache that occurs there that squeezes the head like you got that 80s headband or tennis band on, right? Migraines, this is what most people think, come with nausea, some signs of vertigo, or some signs of visual disturbance or abnormalities with smell, taste, touch, and sound. And then the neck headaches, generated from the neck, usually comes up and around, but starts in the base of the neck, somewhere in this back position, and radiates up and around. So gives you some general information there. And let's take it to the next one. Well, we're going to talk about sinus and cluster here really quick. Unfortunately, for a sinus-based headache, that's typically going to our medical colleagues for medication or some ancillary strategies to try to prevent that. So unfortunately, it's a real thing here in Austin that allergies can be year-round. So please take note of that. And if we see these in our office, this is often a pretty quick referral. The cluster headache's a little bit more important. It's usually pain right around the eye. It is sharp, piercing, stabbing, lasts 15 minutes up to about 2 hours. And even some people will say it's a sharp piercing when they can last half a day up to about 3/4 of the day. Usually there's discharge, nasal discharge, runny nose, watery eyes, because it starts affecting those areas around the nasal area and the eyes. Some cases it's related also to, like, you feel like you're having like an allergic reaction. Again, these are things that we don't treat at Airrosti, and if we sniff these guys on the history and consultation and exam, our medical colleagues are more than adept and capable of helping you guys out. TMJ, we see this in our office. This is one of the underappreciated reasons for headache, and it usually occurs with like tension, pain that occurs here. And sometimes it can go up and around the ear, and sometimes it can circle around the back to the other side. So pain right here in front of the ear, this jaw joint, it usually goes up and around. Typically, it can be one-sided, although when the mechanics of one side of the jaw is off, it can lead to problems on the other side of the jaw as well. The jaw is a joint. It's got a condyle here, and it's got a little knuckle. And in between, there's a cartilage disc that exists right in here. Sometimes that disc can be displaced or moved and lead to grinding or quite a bit of pain and discomfort that will manifest with headache-like symptoms. It can lead to grinding of the teeth. Oftentimes, you'll take a look at your teeth in the mirror and say, wow, that looks kind of chipped for some reason. Trauma can cause a TMJ-related issue, or just high stress. People are stressed. They clench more as a result of stress. So we do see these at Airrosti. We do musculoskeletal work for the jaw muscles and the face muscles here. Some work around this band-like pattern here. Give you some simple exercises for stress reduction and tension reduction. And these are things that we can help out with this TMJ-related issue. Tension headaches. This is one of the most common types of headaches that we see in the office. This is dull, aching pain. This is like that 80s headband that I was just mentioning. You know, if you're 80s and you did the aerobics, maybe you wore the headband. If you're the tennis star, maybe you wore the headband around here. But this pattern that goes around the back of the head, typically bilateral, typically goes all the way around the head versus one specific and particular area. Dull, achy, stiff, tired are things that report. The more that you're locked into bad positions and postures, like looking at your phone where your head's pushed forward, or you're looking down at your tablet like this, the more likely those muscles are start to get tight, tired, and tense. So this is often linked to work-related postures, and it builds over the course of the day. A lot of time with these tension headaches, people wake up and they feel pretty good the first couple hours, but they start to get to about noon, and the stress of the day starts to get to them. So what do? We manage your stress levels, deep breathing, take breaks at work, really work on posture, how you position your desk, how you are standing at your desk, your computer position. Do some deep meditative breathing. That reduces tension across the whole entire body. And then the stuff that we do is effective as an adjunct. Hands-on therapy, reduce tissue tension, rehab. Let's put your body in good positions with rehab exercises, simple stretches to lengthen, reduce tension and tiredness through those tissues. Migraine headaches. There are different types of migraine headaches. There are numerous variants of migraine headaches, and those variants can be anything from a common one, your classic migraine, to a complicated migraine that has multifactorial cause, to one that just affects the eyes. They call that the retinal, to chronic migraines. You're getting them for days and days and days of the month, to vestibular, where your balance is off. The room is spinning. I feel like I'm going to fall over. So different patterns within the migraine world. And when these come through our door, a lot of times we have to treat these or co-treat these with our medical colleagues. First thing, sometimes the migraine, the serious and sinister migraines can be pretty scary things, very seldomly, but it's possible. They can be an infection, a tumor, something going on in the brain itself. So a lot of times when we get these and they're serious and sinister and patients are vomiting for days, we ask for help from our medical colleagues to rule out the hard stuff. Our treatments are secondary for this condition. And when the doctor says there's nothing serious or sinister, sometimes what we can do can be of secondary benefit in addition to medication. Some migraines have an aura. You may notice disturbances in your smell, your taste, your touch, your sound beforehand. And if you can get these early, sometimes you can take a prophylactic medication to shut it down pretty quick. Sometimes they'll be pulsing and throbbing specifically on one side of the head. That's another clue that you're getting a migraine. Again, abnormal reactions to smells, touch, taste, sounds, visual disturbances are possible. A lot of times, the more active you are, the worse it is. People usually will say, I like laying in a dark room, reducing the external stimuli. And in some cases, nausea and vomiting is very possible. Again, getting our help from a medical colleague is important for having a true migraine headache. Triggers to migraines, hormonal fluctuations, varying levels of estrogen, progesterone, thyroid, and other hormones inside your body can and do make a difference. Sometimes things in foods, one of the most common food additives is a preservative called monosodium glutamate, and you'd be MSG. You'd be surprised how many foods that is in. It's a preservative to keep foods on the shelf for a long and extended period of time, and that is known to be a trigger, as well as certain preservatives and dyes in food as well. So usually we advocate a fresh whole foods diet if you get a chance, but just know that certain food sensitivities, food allergies are very common for migraine triggers. Some people are more sensitive to alcohol. It's the sulfur in alcohol or some of the preservatives that keep the alcohol on the shelf, namely wine and caffeine. Caffeine can be a trigger in some cases. Stress to your body. Stress can occur from sleep, jet lag. That's the person that flies. Well, nobody's really flying these days, but if you're doing international flights to Canada, Mexico, China, Japan, any stress to your body can be a trigger for a migraine. Changes in pressure. We all have that old uncle that we thought was crazy when we were younger, that aunt that was crazy when we were younger, that, oh, I really start to get these headaches or my joints ache when the weather changes. Well, guess what? Weather can be a trigger for tension headaches, neck headaches, they call it cervical headaches, or even migraine headaches. Medications can be triggers. Certain environmental triggers, what you smell, like pollen, or in Austin, we had some really bad weather. The rotting, bushes and shrubs and trees and palm trees, some of those can trigger headaches as well. Intense exertion, the more stress you put through your body, the more it wants to manifest with a headache. And then stress, we're a stressed out society from top to bottom. So all that can manage with migraines. And that's why there's no one singular recommendation for a migraine. It's customizing the plan for the patient that works. Another big one is neck headaches, cervicogenic headaches. These, again, neck-induced headaches that start at the base of the neck, back here, and then go all the way up and around, all the way up and over here. Back in the back portion of your neck, there are nerves, there are joints, there are muscles. All those tissues can get inflamed from stress, tension, positions, change in pressure, barometric pressure outside. And a lot of times people think that these headaches are migraines, but the classic pattern is it starts at the base of the neck and then it starts to work itself up and around. And that's the clue in the history. You're dealing with a neck-based headache versus a migraine headache. Often these are not as sharp as pounding, pulsating, or stabbing. Oftentimes there's not a lot of visual disturbances, abnormal reactions to smell, taste, touch, and sounds as a true migraine. So again, starts at the base of the neck, typically no neurological signs, and typically progresses and works its way up when your neck is stressed over the course of the day. These are typically better first thing in the morning. Right? So the neck headaches, what are the symptoms here? Stiffness, neck range of motion is a big one. And that's something that we check at Airrosti. If you're coming in with a headache, what's your neck mobility like? And reports, listening for reports of deep neck pain. One of the underappreciated things is, posture and position of your neck. And here's my analogy. Here's my phone. This is what I'm holding here. Imagine I'm holding this phone closer to my body. All right, easy to hold. Now, imagine I'm holding this phone away from my body over the course of the day. This is easy, 1 minute, 2 minutes, 3 minutes, 4 minutes, 5 minutes. But imagine I'm working over an 8 to 10 hour day, because very few people actually work 8 hours a day. It gets harder to hold this 1 or 2 pound device away from my torso for approximately 8 to 10 hours a day. And that's exactly what occurs when you're in this head protruded forward position. When your head is protruded forward and you're looking down, it's like holding a 10-pound bowling ball, but instead of over your shoulders, away from your torso. Now, those muscles, tendons, and ligaments in the back of your neck will start to get very, very upset, very angry, very fatigued. And that's what occurs with that cervicogenic-based headaches. Those tissues are working not 9 to 5, they're working 9 to 9 all day long, because we're still working on portable devices even after the workday. All right. Triggers, again, starts with neck pain, goes up and around, that's classic, and then structural. Sometimes you'll get it from sleeping wrong, sometimes you'll get it from carrying something behind your neck or lifting overhead upright, but usually it's progressive over the course of the workday. All right, what does this form of headache respond to? Things that we do. Manual therapy, working on the muscles, tendons, ligaments, and joints. Joint adjustments and manipulations. This is a very small percentage of what we do at Airrosti, but some patients out there, some people on the webinar may be going to a traditional chiropractor. In that case, some of their adjustments, manipulations may be able to help you as well. Stretching, loosening up the muscles of the shoulder, muscles of the neck. Typically ice, pain control, inflammation, rehab, getting those tissues and those joints moving. And then in some cases, an over-the-counter anti-inflammatory, which is an NSAID, non-steroidal anti-inflammatory, typically works. Typically for migraines, those non-steroidal anti-inflammatories, the Motrins of the world, the Aleve of the world, are not very effective. In some cases, for the neck-based headaches, those can help you as well. That's another differentiator. So being proactive, I think on the next slide, we're going to turn it over to our recovery and rehab specialist, Chris. Chris is going to take it from here in a second. He's going to give you a couple tools that can be important for the prevention aspect, but hopefully you got some good information from what's going on. So not all headaches are migraines. And if I have a migraine headache, medical attention, a cluster headache, medical attention. But if it's a tension headache, which is very common, TMJ, neck-based headaches, we can help you. All right, let's do one more slide, Chris. All right, and I mentioned the prevention aspects here. If you look at that lady that's sitting in the chair and you're looking at her on the left side of the screen, she's in full-on slouch mode, so her head's pushed forward. Her shoulders are rounded forward. She's really looking forward towards the camera. And that's putting a lot of stress. Stress where? Anything from the low back, the mid back, the shoulders, the neck. Over time, she's got to pay the man somehow, as the saying goes. And paying the man will be neck pain, headaches, things that can easily be rectified. We flip it over to the right. Notice that she's vertical, right? Her torso is vertical. Her neck is a little bit protruded forward and pointed downward, but it's not as bad as the picture on the left. Also look at her elbows. Her elbows are bent to about a 90-degree angle. When that's the case, she is not shrugging her shoulders up. When you shrug your shoulders up like this, you're generating more tension that will transfer either into a tension-based headache or a neck-based headache as well. So a couple points to consider: try to get as upright as possible. Try to keep your elbows bent to about 90 degrees. Try to keep the hips above the knees when you're sitting in the chair. For clarification purposes, it would be ideal if her monitor was directly in front of her eyes. So instead of her looking down towards the monitor, she's looking directly forward into the monitor as well. Just a couple little form points there, but it does matter, especially over 8 to 10 hours, and then working 5 days a week, 40 to 50 hours, that does matter over years and years. All right, Chris, let's push it to the next slide. All right, our recovery specialist, Chris, will take it from here.
All right, thank you. All right, so we're going to go over 3 different exercises that's going to help with all that Dr. Pappas was just talking about. You can feel free to join along while I do this. The first is going to be an SCM scaling and a trap stretch, or just called a 3-way neck stretch. So a couple ways you can do this. One is with an elastic band. We'll do it seated as the visual shows. So if we want to stretch out our left or our right side, so in my case, I'll stretch out my left side, I can bring my left hand and I can grab the bottom of my chair so that it helps track down my shoulder. And then we're going to do 3 different positions. So first would be, I'm going to bring my right ear to my right shoulder, again, as my left shoulder is tracking down. And you're going to be feeling the stretch in the side of your neck. Typically, when I give this, I'll do more of a static hold versus a repetition or mobilization movement, but we can hold that for about 1 minute. And then typically I'll go ahead and switch over to the other side. The second stretch, all we're going to do is we're going to rotate our nose down towards the floor or the armpit, and you're going to feel this in the back side of the neck. So again, right ear to right shoulder, and then just slightly rotate, bringing the nose down to the right shoulder or down to the ground. And same thing, I would hold this for about 1 minute, and you'd be feeling this in the back portion of your neck. And then finally, you can reset, again, holding on this left part of my chair. I'll bring my right ear to the right shoulder, and then this time I'm going to rotate upward, so nose to the ceiling, and then you're going to be feeling this more in the front portion of your neck. All right, so the second exercise is cervical retraction or chin tucks in a seated position. So like Dr. Pappas was talking about, typically for 8 hours of the day, we're leaning forward on a device or on our computer, leaning forward, and it's really angering our neck muscles. So with this exercise, we're going to be working the deep neck flexors, or the muscles in the front portion of your neck. Different ways you can do this: seated, standing, laying on the ground. Again, we'll be going over the seated position. Feel free to do this at your workspace. You can do this in the car or just generally watching TV. What you want to do, I will typically give the cue. I'll turn to the side here. I'll put my finger on my nose, and then I'm going to work on pulling my chin only back into my neck. So again, finger on the nose, give myself a double chin, hold for 2 to 3 seconds, and then just returning back to that neutral position. You should, again, feel it in the front portion of your neck, and you may feel this area in the back portion of your neck engage as well. I will typically have you do this about 10 different times, 10 reps. This can be done over the course of the day, 3 to 4 times, 5 to 6 times a day. One thing we want to make sure when we do this is that we're not hiking up the shoulders when we do the chin tuck back. So we want to stay nice and relaxed in our upper traps, and again, just pulling back and then resetting. And then our third and final exercise is going to work on scapular retraction or depression. So just working on setting or retraining our scaps. What we're going to be doing is working our scapular stabilizers, or the shoulder blade stabilizers, through our scap setting. So really what we're trying to do is, again, avoid engaging our traps, and we want to work on pulling our shoulder blades together and sending the shoulder blades back down into your pocket. So the best way to do this while seated is go ahead and you're going to be squeezing your shoulder blades together like you're trying to pinch a penny or a pencil between the shoulder blades, and then being able to shift downwards, sending those shoulder blades back into your pockets. Some people do have trouble doing this. Mentally, just being able to do this, and visually it's hard to tell. So if you need to use a cue, what you can do is you can lay on the ground, or actually easier, going up against the wall and using the wall as your cue to feel your shoulder blades, again, squeezing together and shifting back down towards the ground. When we do this, making sure, again, our traps are nice and relaxed, squeeze together, shift down towards the pockets.
All right, thanks, Chris. So I'm going to explain to you something that's very, very helpful. And I know one of the questions that's circulating around was, can we get a copy of this presentation? And the answer to the question is yes. And one of the most valuable parts of this presentation is not my dad jokes and bad jokes and talks about 80s headbands. Nope, that's not it. One of the most valuable parts of this presentation is actually this headache tracker. If you are having headaches, you want this piece of paper. You want to copy this multiple times and track this because you want to know patterns. When it's happening, what are your triggers? What reduces your headache? How intense on a pain scale of 0 to 10? What did you eat? When did you eat it before the headache was triggered? Because all of those give the doctor or you, the patient, good diagnostic information to accurately assess and therefore recommend the right treatment so you can have as little pain and suffering as possible moving forward. So one of the magics of this presentation, again, is this slide right here, this headache tracker here. If you have headaches and you're able to get access to this presentation, please print this guy out and start logging this and tracking this, because this information will help you and will help your doctor get to the right diagnosis so you can get the right treatment to limit any pain and suffering. So this is an important sheet right here. All right, let's push it forward here. All right, Chris, you're up.
All right, Dr. Pappas and Chris, thank you guys both for going over all the content in the presentation. And for those that were wondering, the presentation is actually being recorded. And at the conclusion of it, after we get done with the Q&A session, I'll be sending a follow-up email with some additional information and a PDF of the exercises that Chris Norris went over. So you guys will have all the additional information that you need. And of course, if you have any more questions, for sure send those over in the chat function and we will make sure to get those answered once we get to the end of the presentation. So just to go a little bit more into Airrosti. So for people, those of you who are on the call who have been to Airrosti before or have been to in one of the presentations, a lot of these numbers are going to look familiar. So we like to show these to show that we are making sure that we stay accountable to all of our patients that actually come into our clinics. A little bit of an outdated statistics, but last week or the week before, we actually saw our 1 million patient case come through our doors, and we made sure that they were taken care of well. On average, we generally only have to see our patients about 3 to 4 times to get you to total pain resolution. And then also, as you can see at the bottom, a lot of our patients come and seek care at Airrosti after they've been to either traditional chiropractic care, physical therapy, or referred to a specialist or received imaging. So like Dr. Papa said, number one, we want to make sure that you're in the right place and it is something we can take care of. And for those that we can take care of, we see that 88% report a full recovery. And then for those totally that walk through our doors, 99.6% would recommend us to their family and friends. And so today also, Dr. Pappas and Chris talk specifically about some conditions as far as headaches that they see coming to their clinics and how to be preventative with those. But like we explained at the beginning, we see a wide variety of different things. So it could be something acute, like a headache or an ankle sprain, a hamstring pull. It could be something chronic in nature that you've been dealing with for years, months, and decades on end, like lower back pain, shin splints, sciatic-like pain, or things of that sort also. So, and lastly, Airrosti is an in-network benefit for all of Austin ISD's Aetna Health Plan members. You don't need a referral to go see any of our providers, and our clinics are currently still open. We're making sure that we're adhering to all the recommendations of the CDC to make sure that the environment is safe for not only our treatment teams, but also every patient that walks through our doors. Also, you see the contact information for Dr. Pappas and his email. If you have any more questions about how you can get scheduled onto Airrosti, you can either call our 1-800 number, as you see on the screen, or you can visit the airrosti.com website. So lastly, I would like to thank you all for joining us. And of course, if you have any questions, we will stay on the line for a couple more minutes to get those answered for you. But if not, we definitely want to be cognizant of your time. So thank you again for joining us, and we hope you guys have a great rest of the day.